Good evening, everyone. My name is Tolu Odubanjo, and this is Talk to Tolu Toro. We are here tonight to discuss a very, very important topic. And please, I would like you to go and share these flyers and share the link. So tonight's topic is going to be the impact of meeting special needs with Dr. Abimbola Oyedokun. But before we start, I'd like to tell you a few house rules. Please keep your microphone muted until you want to say something. We're going to unmute you so you can, you can ask your question. Please, please, please help us share this flyer to everyone on your platform. Get your questions ready. And another thing I would appreciate us to do tonight is we can show our faces. Let the speaker see your beautiful faces so she can connect. Please, I really like if you can show your faces. But if you cannot, it's okay. Thank you. Get ready. But before we start, I would like to introduce to you Dr. Abimbola Oyedokun. Our guest tonight is a consultant psychiatrist in child and adolescent mental health and psychiatry of intellectual disabilities. She currently works with the NHS UK, caring for children, young people, and adults with intellectual disabilities who have mental health difficulties. She has a special interest in neurodevelopmental conditions like autism and ADHD. She has a passion for teaching and impacting knowledge in areas of Christian living and mental health. She's married with 3 beautiful boys. Welcome with me this evening, Dr. Abimbola Oyedokun. Please go to the chat room. Go to the chat room. Let me say welcome, Dr. Bimbo. That's what I call it, Dr. Bimbo. I don't use the Abimbola. Please go to the chat room. Welcome, ma. Thank you
Thank you very much. Good evening.
Thank you for joining us. Thank you for honoring this invitation. We sincerely appreciate your time, ma. Okay, Dr. Bimbo, are you ready for us? Please make it as informal as possible because people have been asking questions. What do I even mean by special need? When we talk about people in the UK, it is easy for them to understand. But people who have seen these flyers back home in Nigeria, especially, have been asking, what I know they can Google it, but it's still somehow to them, to some people. Please, ma, bring it home. Make it, all those big dramas in medical science, break it down for us, ma. Thank you so much, ma. The microphone is muted. Please go to the chat room and welcome, ma. And let's know where you are joining from. My name is Matilda from London. I am Dr. Ozion from Canada. We can hear you. We can hear you, ma.
Okay, yeah.
Okay, ma. So let me quickly ask, ma, briefly, to you, what is special need? Let me start with that. Thank you.
Okay, thank you very much, Dr. Tolu Toro. It's a privilege to be on this platform this evening. Thank you for this opportunity. So I would like to start by saying special needs is when a child or a young person or an adult has a physical, emotional, behavioral, or learning disability. And I'll say it again. Special needs occurs when a child or a young person or an adult has physical, emotional, behavioral, or learning disability that limits one or more of the major life activities, such as caring for oneself, like being able to feed themselves, being able to dress themselves, being able to, have a wash, walking, hearing, seeing, or learning. Now, this impairment is such that the child, the young person, or the adult requires additional or special services to have a good quality of life. So that's what we call special needs. And if you look at the needs that I have highlighted, these are things that these are tasks or skills that we all do, without thinking about it. You wake up in the morning, you want to have a wash, you pick the dress you want to wear or the clothes you want to wear, you decide what you want to eat, where you're going to, you can walk about, you're hearing, you can, if it's for children, they can get into school and they can learn. However, for a person who has got special needs, there's a limitation such that they cannot perform these functions just like any other person would. And so in order for them to be able to perform these functions, they require additional or specialized services. And that's why they are known as special needs. You see, there are needs that are common to everybody, but they can't just perform these needs without help or support. Thank you.
Sorry, ma, I'm writing notes and I'm enjoying it. So I'm sorry, I forgot I have to ask you some questions. I was just going through some stuff and I see that according to, I got some data from Department of Education.
Yeah.
And I noticed that a lot of Black African children are identified with special education needs at the rate of 4.8%. Black African children. While white African children in Britain, they have Black African 4.8, white British 4.5, and Black Caribbean 5.8. So, being a black woman, our own is high. And it kind of like, what's going on here? So, can you please tell us why is it important to help children with special needs?
Okay, very good question. Like when I was talking about what special needs mean, I was talking about the fact that they require additional or specialized services, to have a good quality of life, just like we all do. So why is it important? I'll look at it from two ways. Legally, in every country, and I was going through different countries. Every country has, some countries will call it Children's Act or Child's Rights Act or the Children's or a Child's Act. Now, legally, every child should have the access, to be able to live life to the maximum potential, whether in their health, whether in their education, whether in their in the environment or whatever decision they want to take. Every child has a right to be supported. So legally, in every country, no matter whether the child has got special needs or not, a child ought to be supported to be able to get to the maximum potential in life. And so for children with special needs, they are not exempt. They are also children or young adults, or young people or even adults. So it's very important, that the help is given. And so that means that even in schools, any school which doesn't provide the support or the additional services required for a child with a disability or with special needs to perform to maximum potential, they're actually breaking the law. And on the other hand, morally, like we have said, every child who is born on the face of this earth should have almost or equal opportunities, to be able to fulfill their potential. If these children with special needs, if they're not given additional support, then there's going to be neglect. Then they won't get the education they need. They won't get access to services, health services. They won't get access to social services, social facilities. And this is what we see a lot, in this cohort of children or young people or adults that we're talking about. And I'll just make a note about the statistics that you have mentioned. So obviously, it looks like is so much, when you compare the statistics for the Caribbeans, Black people, and also for the whites. However, I would like us to take into consideration the fact that those statistics is in proportion to the population. So obviously, where you have the population of Africans and Caribbeans, it's smaller compared to the white population. So it will look like I mean, it would look like the statistics are higher. But I would say that on a general note, would say in the UK that almost about 1 to 3% of the whole population, have one special need or the other. Yeah. Thank you.
Thank you, ma. So, okay. I'm putting down something. Please, if anybody have question, put your question, send them to me directly if you want to have some private question, bearing in mind that no name is going to be mentioned. And if you can send them for everybody to see, it's okay. And if you have an example or comment that you want to share with us, please feel free to use the icon to raise your hand, and we will meet you. Thank you, ma. I have other questions I want to ask. As an African woman, have you come across parents who are living in denial that their children have special need? And from your all your previous, I mean your son, not previous, your year of experience, have you come across parents who are this thing is there, it's obvious, but they are living in denial?
Right. Thank you very much. Thank you very much, Auntie Tolu. Yes, I have come across parents who, who are in, well, I wouldn't say a denial, um, because what I want everybody to understand is that when you have a child, when a woman gives birth to a child, um, and the child starts growing, no mother or father wants to put a label, on a child. And so, and then we always say that we don't compare children because the rate at which they grow, the rate at which they develop, it differs. So most times you find out that initially it's always, oh no, the situation would change, the child would grow out of it. You see, so yes, I've met quite a number of parents, especially from African background, who are in denial about what's going on. And one of the reasons for the denial is that I have found out that I've heard parents who would say, um, I've heard parents who would say it doesn't happen. We don't have any history of that in our family. Or who would say, um, I'm a Christian and I don't believe in that. I can't, that's not the portion, that's not our portion, in Jesus' name. So, but I would like to point out, I'm a Christian, okay, and my faith is very important to me. And I know impossible what is impossible with man, is possible with God. However, I also stress the fact that God has also given us wisdom. He's given us wisdom to be able to navigate difficult situations, to be able to identify what the problem is. So yes, I've come across parents who are in denial. And the truth of the matter is that it's the parents, especially the mother, that would know from a very early age that something is just not right here. You see, and another reason why people don't want to say it out is because as from in African backgrounds, the awareness is not there's not much of awareness about it. And so people talk about how will I say it that my child has got this or my child has this, so obviously it's a form of some form of stigma, and that makes people not to want to, they're in the stage of denial, and they find it difficult to accept. You see, they find it difficult to accept that it's happening. And then another thing I've also seen is that, especially in the middle class to like high class status, it's almost like, no, it can't be happening to me, you know? So almost like, oh no, it can't be happening to me. There has to be a reason or an explanation for this behavior or for this presentation, that I'm seeing. So you find out that actually it takes a long while before people now get to that point of, okay, yes, this is it. I know of a situation where a lady had concerns about her child, had gone taken the child to the doctor, um, and the doctor said, oh, I think it is this. I think it could either be ADHD or it could either be autism. And there, And she was like, no, it can't be, give me 6 months, let me go and come back. And she went, and she came back herself because things got worse. And she had to come to, she had to come to that bitter, reality. So I was calling bitter in quotes, reality. And I would say that the first stage that I usually see, with parents when they have children with special needs or learning disabilities or, or neurodevelopmental conditions is they go through a grieving period. And I call it the grieving period because it wasn't what they were expecting. Obviously, nobody wants to have a child and then the child, would not develop like, develop or grow like other children are growing. So they have to, it's that almost like as if they've lost that child that they were actually, hoping hoping to have. So that again, that's another thing that makes, that puts them in the position of denial. Thank you.
Thank you very much, Ma. Can I quickly ask this question here? I've got two
Yes.
questions here. Someone is asking, can you dictate if a child will be autistic from pregnancy? Also, can a child exhibit some of these learning difficulties in adulthood and have no traces of such as a child? Can scan pick it up if a child is autistic?
For now, no. To the best of my knowledge, no. Though I have come across a situation where a woman had told me that she kind of knew to an extent because that wasn't her first child and the child was not moving in the womb like the child should move. But when they go for the scan, everything is fine. So it was at that point right from pregnancy, she had started thinking about the fact that, something is not exactly right here. But having said that, that is just one case that I have seen. And to the best of my scientific knowledge, so for now, we do not have a way of detecting whether a child, a baby in the womb has got autism. Though I must say at this point that autism is we know there's a genetic link. So if a family has got a child or a parent, with, or a family member with a diagnosis of autism, then the probability that other family members would have autism is higher than in the general population.
Okay, ma'am. So
Now,
is it possible?
Yes. Okay, yes.
Is it possible for the child not to exhibit those traits while they were younger, and as they get to adult stage, they start exhibiting it? That's the part B of the question.
So, for example, conditions like autism, when we talk about autism, we talk about autism spectrum condition or autism spectrum disorder. And when I'm explaining autism to people, I give an analogy of think about a straight line with point A to Z. So that means we're talking about 26 points now. And everybody on that line, they've got autism, but they are on different, positions. They're on different points on the line. And that's why it's called a spectrum. So on one end of the spectrum of autism, we have the non-verbal autism, the non-verbal autism, and they have associated learning disabilities, learning difficulties. And on the other end, we have what in the past used to be known as the highly functioning autism. They can do everything themselves. They do not have any learning disabilities, so to speak. However, they have autism because they struggle, with behavior and with social interaction and social communication. Now, can a child have it can someone have it as a child and then it's not detected until adulthood? Yes, because I'm sure if you look on it's as autism and ADHD is becoming more, as we're having more awareness, we're having more and more adults being diagnosed, with this condition. So especially for like girls, I usually say that for girls are very intelligent and they grow up very quickly. So a female child who notices from a very young age that I'm a bit different to others, you know. Um, very quickly she learns how to what she should do in situations. She learns what to do in what to do in social interactions, and and this is what we call masking. You see, masking or camouflaging, just trying to fit in. But what happens is that by the time they start getting to high school or secondary school, because the social demands now get it's I mean the social demand increases, and it's now more than what they can bear. So that's when we begin to now see the cracks, and then you now find out that it begins to you find out that actually they're really struggling to to integrate into the society, and you're like, oh, what's happening here? And I would say that for some people it might be that when they were younger they would just say, oh, she's very quiet, or he's very quiet, or he's very odd, and they're
Or
the ones who
weird.
will
They're
not cause.
according to their language, weird.
Yeah, exactly. Weird. And they will not cause any problems, so to speak. They just keep to themselves. But it's when they grow older and they need to now integrate into the wider society. So that's when it now becomes, more difficult. And for conditions like ADHD, in the past, it was commonly known as the naughty boys syndrome. It would
Syndrome.
just be like, oh, that boy, or that girl is very troublesome. She doesn't sit still. She's always getting into trouble. Not actually understanding that this person is, actually finding it difficult, to integrate. So it's now so when when the child gets into young adulthood and now needs to go into, college, university, or even starts working, and that's when you now find out that the strategies they've been using to cope in the past is not, is not suitable anymore.
Mhm.
And at this point, I would like to say that conditions that are associated with special needs, because I know I've been talking about it. Conditions that are associated with special needs includes autism, ADHD, hearing or visual impairment, or physical disability, intellectual disability, commonly known as learning disability, then genetic conditions, like Down syndrome. And then there's also the learning difficulties. Now, I would like to say at this point that learning difficulty is different from learning disability. So learning difficulty it includes conditions like dyslexia. And also another condition with special needs is also sensory processing difficulties, which people with autism or ADHD would most times present with. Thank you.
Thank you. Thank you, ma'am. So I'm asking another question. Sorry. Someone said, hello, can you please ask Dr. B to bust the myth of MMR vaccine? That is the measles, mumps, and rubella vaccine. He said also some people taking their kids to Nigeria. They take them back to Nigeria, saying the UK education is failing, and the reason their child is not speaking is because school is not helping. Not, I mean, not in code knowing that the child has autism. What can you say about that, man? What is wrong with MMR vaccination?
Okay, let's start with that. To the best of research that we have done, that has been carried out, there is, well, I would like to say that, okay, let's start from this point. There is no evidence to show that MMR is a sole factor in causing autism. And because there are children who have had the MMR vaccines, who have not had autism. And there are children who have not even had the vaccines, that have gone on to have autism. So, I'd explained earlier that autism sometimes, can be genetic. So if there's already a genetic predisposition, whether there's MMR or not, you see, the condition would still manifest itself. So I would say that for now, there's no evidence to show us that MMR is linked solely as a causative factor for autism. So that's one. Now you asked another question about people taking their children, back to Nigeria, because the child is not. The child is not speaking because the educational system here is failing them. as much as possible, to the best of my knowledge that I know about the educational system in this country, I'm not a teacher, but in the position by the virtue of my job, I work closely, you see, with schools, social services, and the local authorities. And I know that the resources in NHS, as much as possible, they've put in a lot of resources into what we call early help services. And almost every local council, all over the country, they have programs under this, or I mean, they have programs under this early help development program, such that even in nursery, from nursery, all these conditions, they can be prescreened for these conditions. And I'm sure for those who have had children here, once your child is getting to the age of 2 years, there's the assessment that is done by the health visitor. You see, there's the assessment that is done by the health visitor when they're looking at social development and social interactions, because we know that we can detect these conditions from an early age, giving them early intervention and early help. You see, it helps. And so, what are some of the things they will talk about? They'll talk about things like the speech and language therapist. So, well, obviously, I don't know the whole story of this,
Yeah,
yes,
it's okay, ma.
of this person, but I think
Sorry,
that,
ma.
yes,
Somebody
ma'am.
just sent a message now that said it was due to a research study that reported a link in a prominent journal about 20 years ago or more. But the paper was recalled, and other studies have shown that there is no link to it.
That's
Dr.
MMR to autism.
Dr. Is that Dr. Eso? Go on, ma.
Is that
Sorry.
MMR to autism?
Yes. No
Yes, so
link.
that's why I said that there is no evidence, you see, because obviously, like they said, that paper was recalled, and further studies have gone to show we've not been able to solely associate it with this. So yes, thank you for that.
Thank
Um, yes, so
Okay, ma.
I was talking about the non for the child that was not that I mean that is not talking.
Mm.
I would say that, well, it, like I said earlier, is the right of every school to help every child, and every local council to help every child, you see, to develop. Most schools might not have access to speech and language therapies, but most local authorities should have access to speech and language therapies. And once these conditions are detected either in nursery or in early school, with the help of the GP and the pediatrician, they can make referral to these services. On the other hand, I would like to say, like we all know, for NHS, there's a long waiting list. So if they say that, or they've been referred, and they've not gotten back to us, then that might be a possibility, because almost every service, at this point, to be honest, there's a long waiting list. And when I say long waiting list, it's a waiting list of at least 18 months, 2 years, you see.
Wow.
Yes, I mean, is that long? Yeah.
Thank you
And then
so much.
there was a third part to that question.
Mm-hmm.
Sorry, what was the third part to the question?
I think you have answered. Say about the MMR speaking. Okay, failing and reason their child is not talking, is not speaking. Is it because their school is not helping?
Oh no, so that's all. I think I've answered that. Yes.
Yes, you have.
Yes, yes, yeah.
Okay, thank you. Thank you so much. I'm still going on. I'm going on. Sorry.
Okay.
I have questions coming in. I have some written sent to me in another way. Somebody is asking in general, it says, what is the correlation of prematurity with developmental disability? And what are the possibilities in intervention at the point of birth, as enough oxygen is needed to brain development and function?
Sorry, can you read the question
I don't
again?
understand the question. It says, what is the correlation of prematurity with
Okay.
developmental disabilities?
Okay.
And what are the possible intervention at the point of birth? That's when there's shortage of oxygen to the brain of the baby. In my own way of understanding, can it affect a child to have not, to have
Okay, okay. Yes, I think I understand what the person is asking for now. So, good question. And I think that would lead me nicely into causes of special needs or disabilities. First of all, I'd like to say that majority of the causes are unknown. We cannot say categorically that this is what has caused, this young person, or this child to have a disability or to have special needs. However, we've been able to identify what we call risk factors. And these risk factors, I would divide them into three major areas. So during pregnancy, if a mother is exposed to different, to toxins, and I'll not go into the specificality of it, but things like maybe alcohol or drugs or even certain medications, or it might be that the mother had some certain infections during pregnancy, you see, and it might affect the development of the baby inside the womb. And so this can be a cause. Now, during delivery, so this next point I'll talk about, okay, and then obviously, if there's been a genetic predisposition from the beginning, sometimes you have some genetic conditions that maybe in the mother is what we call recessive, or in the father, is recessive. But by the time it comes to, they give birth to the child, it now becomes it's something that's dominant or that we can now see. So that's part of genetics. Now, coming to the point of during delivery. So this person's question, the person asks about prematurity. Yes, we have noticed that prematurity can be a risk factor, to having special needs or having a learning disability. But I would want you to note what I said. I didn't say prematurity causes it. I said it's a risk factor because you've had children who were born prematurely, like they would say, but have no learning disability. And you have children or babies who were born normal time, after the normal gestation period, and they've gone on to have a disability. So I'll say it's a risk factor. Now, what are the other risk factors? Babe, injury during delivery, lack of oxygen during birth, maybe there was a medical negligence, or there was something they didn't pick up, on time, a condition they didn't pick up on time. Now, when I say condition, maybe the baby was not having enough oxygen, or maybe the cord had been tied round the neck of the baby, or maybe the baby wasn't coming. The baby was coming in what we call breech. So breech is when the baby is not coming with the head, you see. And then it's that at the point of delivery that they discovered, oh, there's no way we can deliver this baby, and already the baby is in a situation that we call is already distressed. So obviously, if there's not enough oxygen, it can cause this condition. Or if it happens that when a baby is born and there's a high level of jaundice, there's a high level of bilirubin, which causes jaundice. So jaundice is the yellow discoloration, or that occurs on the baby's skin. And some of us would remember, or some of us can remember that when, in the delivery, sometimes some babies, they would say they take blood samples and they'll say, oh, the level of bilirubin is high. And then they give them the light therapy to break it down. So if it now happens that the level of bilirubin is too high and it's not detected on time and it's not treated, it's not treated promptly, it can cause a learning disability. Or sometimes after delivery, if there's been an injury to the brain or spinal cord in the developmental period, or it can be that maybe a baby that was born normally now had an infection, an infection to the brain or an infection to the spinal cord, and then it now causes the disability. So I think, and I would like to say at this point that I would like to bust the myth that the parents did not sin and they did not do anything wrong, you see, to have a child with a disability. I can see Auntie Tolu smiling because I've talked to a lot of parents who would also say, was it something I had done wrong? No, because again, I think I'm going to bring my faith into this at this point. Some people would say, oh, it's because I'm being punished for the sins that I had done, sins I had committed in the past. And I'm like, no, as far as I'm concerned, as far as I'm concerned, and based on what I know about God, no, it's not true. You see, the fact that a person has got a child with a disability doesn't mean the person is a sinner, or it doesn't mean the person is worse than the other family who don't have a child with disability. So it's nothing the parents have done, and it is not a curse. It's nothing the parents have done. It is not a curse, and and to the best of my medical and spiritual knowledge, it is not. Some people will say, oh, it's a spiritual attack. Well, I would say, first of all, I would say, let's look at it and see what are the things that we can actually, what are the things that we can explain, what are the things that we can actually manage, you see. So it happens to people who do not even believe in anything about spiritual attack. So I just wanted to add
Thank
that
you.
in. Yeah, thank you.
I can see that the way these questions are going, they are going towards clinical part of it. They are making you go into the.
Yeah.
But I want to bring you back, Ma, to the
Okay.
topic that said the impact of meeting special needs. I know you do help a lot of parents. You've spoken to lots of parents, and I know you are currently running a service, running something, a clinic that help parents. Please, ma, and you wanted to tell us what you do. Then at the end too, for anybody joining later, for them to know the services you provide, ma, before we finish quickly, by helping the parents with children, parents of children with special needs.
Okay. All right. So thank you for that. And I would like to start by saying that I very quickly in my career, I discovered that when I speak with parents, and with guidance, everything we talk about, it's about the child or the young person that they are caring for. And I discovered that their struggles, are a lot because the impact of caring for a child or a young adult or an adult with special needs is more than what is 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 more than what we can actually put into words, and I very quickly I discovered that the way I could, connect with parents was after talking about their child or the ward or my patient. So I turn to them and I ask, how are you? Most times they will say I'm fine. And I'm like, no, how are you? And then most times, parents break down and they tell me, most times they'll tell me, Dr. Abby, I'm at the end of my wits here. I don't know how long I can continue, with this. So the impact, and to me, that was where I felt I need to come in here and see how I can help parents. And having done my research, I found out that most times parents have talked about the fact that we don't ask them how they are. We don't have services to provide for their own needs. And the impacts can be, I start with grief, like I talked about the grief of not having the child they had hoped that they would have. And some parents have talked about the fact that it can be, they feel jealous of another family, that have a typical child. Parents feel helpless and hopeless because they have to fight and advocate for every service and support the child needs. Because for some of them, it can be there's the financial need is great because homes have to be adapted. The children will not go to, they need to go to special needs schools. Sometimes the package of care they need has to be is bespoke, such that the parents cannot even afford it. And they have to go, and the local council has to, fund it. And they have to kind of put in an argument. Sometimes it will be refused. They need to go to tribunal. And that's in this country. And then I think about countries like, African countries where we don't even have a service, for this cohort. So the impact is so much. Then we now look at the stigma. A lot of families, a lot of parents, they tell me, we don't go out anymore. We don't go to the cinema. We don't go to the park. Our neighbors, our neighbors they are against us, because of because the child makes noise. I mean, the child or young adult makes noise at night when they can't sleep, and they say, oh, they're disturbing us. Some people would say, oh, the landlord is going to get us out of the house because most of the things in the house are broken when my child becomes unsettled. And again, they've also found out that parents talk about the fact that they can't it's very difficult, even for their own family members to accept them because of the condition that their child has. And so they become isolated. You see, they become isolated. And another impact I've noticed is that they have a lot of physical health conditions, most especially musculoskeletal. So when I say musculoskeletal, back pain, chest pain, and that's because, especially for children or even young adults who can't do things for themselves, because they are constantly doing that, so it has an effect even on their own physical health. And almost all the parents of the patients that I see, almost all of them are either taking antidepressants or taking high blood pressure, tablets, or taking sleeping tablets, because they find it difficult, they can't sleep, they are anxious, they are constantly worrying. If my child cannot, if school is saying, oh my, they can't take care of my child, so what's going to be the next thing? How will my child be supported when my child becomes an adult? And now, because medical science is improving, we're having a lot of children and young people with special needs and learning disabilities, living longer to an old age. I work in a service where I see children and adults with learning disabilities. So I have patients as young as 8 and patients as old as 82. So um, you can imagine the level of needs, that I mean, the level, you can imagine the range and the level of needs that this cohort of people that, I mean, that they need. And I would say that, I mean, and another impact I've found with for on parents is the fact that there's the financial stress, in the sense that a lot of parents have had to give up their work. They've had to give up their work, or they've had to work part-time. But then on the other hand, again, the impact every time is not always negative. Even though the negative part is, it can be, yes, it's enormous, but then there's also the positive part. I've had parents who tell me that, they've gotten to that point where they're learning to love despite what is going on. They're learning to develop patience, such that they're learning to develop patience where it was difficult for them. And they're also learning to be an advocate, to be a voice, for their child. And it's just that, and I think, and I'll say this, for parents on this call who are listening, my heart goes out to you, because sometimes at work, I think I'm just going to, I must confess that sometimes I'm close to the point of tears, when they talk about the impact, on themselves. And they turn to me and they say, Dr. Abby, nobody asked me, how I'm feeling, and how I'm coping with this. So obviously the impact is much more than, than you would see. The tears they cry at night, the sleepless nights. So it's a great impact, and that's one of the things that has moved me to start doing what I'm doing. Thank you.
Thank you, man. So I'll just send you there now. They should follow you on Instagram, Dr. Bimbola Oyedokun on Instagram. Please, if you want to reach her, you can reach her through me, or you can use the Instagram, and you can send them a direct message to her as well. Okay, let's continue, ma. Sorry to cut you short on that. I just
Okay.
want us to stay focused on the topic and not, a lady wants to know if, what's it called? If uh, aminosynthesis can it be used to detect autism? That is the prenatal procedure that
For
involves
now,
taking that
yeah, for
take
now.
was amniotic fluid to check the baby's gene and stuff like that. in the
I
fight
would
of
say for autism, for now, no. I know there's research. I know there's quite a lot of, research going on. Um, but to the best of my clinical knowledge, for now, no. Though, I mean, your synthesis can be used to detect other conditions. Um, so for example, like Down syndrome, you see, and some other genetic conditions, such that, and then obviously the parents will be given a genetic counseling to now decide on what to do, but not for autism, not yet. Yeah.
Okay, ma. Sorry, can I ask, how can I explain to my child's needs to how can I explain my child's needs to other children around them? For example, yeah, if I have a child who has a special need and
Mm.
they're already seeing themselves as weird and all that, different from other child. And other children are coming around them to seeing their friends, cousins, and maybe if you go to how can I help that child to, you know, explain to other children about my own child's need?
Right. So good question. Um, I would say, first of all, it depends on, it depends on it depends on what the condition of, the child is. So, for example, if it's one that's very obvious, such that maybe they're not talking, they can't walk. So obviously, other children around them, would see it, so that, okay, that's this other child is not talking, or this child has their own kind of specialized wheelchair. I would say is always it's always important to tell children, you see, the truth. It's always important to tell children the truth, and in the language that they would understand. And sometimes if we go, okay, because I'm not affiliated to any service, so I'm not going to name any service here. But actually, if you go online, there are resources that you'll be able to get, that will tell you um, how to explain the needs of this child to other children. So, for example, even to the other siblings in the family. And I know there are writers who are writing books. So, like I said, I'm not going to name anybody. If you go online, if you go onto Amazon, even if you go onto Google, there are resources there that can be used to that can be used to educate other children. But as much as possible, I would say that it's always important to explain to a child, as truthful as we should explain to children as truthful as we can be, and in a language that would understand. And we should also teach other children to learn to accept children that are not like themselves, because when they begin to see it, as when they begin to learn this behavior from us, to accept to accept people who we think do not look like us. Because I've had situations where parents will say, I can't take my child on the bus, or my child can't go on the bus because other parents have said their children are afraid of my child, you know.
Oh,
So honestly, so the things is, the things that you hear, the comments that people make, sometimes you're like, but I just think it's because there's not enough awareness, and there's not enough awareness, and there's not enough education for people, to know about it. So I would say, as much as possible, let's be truthful to our children. Let's show them exemplary behavior to learn to accept others. And I think I've just seen someone put a comment on the chat to talk
yeah.
about some resources. So like I said, if we go online, there are resources, that can help us. Yeah.
Okay, ma. Another question I want to ask. Sorry, we'll round up soon. How can um, how can, let's say, a parent to parent, for
Mm,
example, if I have a friend whose child is go who I let's say, for example, I have the knowledge of all these things, and I
mhm,
see that this child is got spectrum of I'm using your language now, see.
mm,
It's got spectrum of let's say ADHD. And I've seen that this thing, I've done some studies and I know that these are the traces of ADHD.
mm.
How can I explain to a friend that you need to help this child to do this without any fear that they are not good, that won't affect our relationship? Let me put it that way.
Okay, good question. Um, so I'll say first of all, you need to be it's a very sensitive issue and it's a sensitive matter. And you need to find the right place, the right place, the right time, to talk about it. Otherwise, the friend can be, can be defensive, you see, because like I would usually say, the most of the time, the mother or the father or the parents, they would have had some they usually they're the first people, to notice and to see that, okay, it looks like there's something here. But like we had said at the beginning, they might still be in that denial period. So, and I can see somebody has also put there the right language. Yes, so the right time, the right language, the right place to be able to bring this up. And I would also want to say that it might be a discussion that it might be a discussion that you need to have with the person over a period of time, not just once. Okay, over a period of
Okay.
time. And somebody has said that don't diagnose. Yes, don't diagnose, because I mean, thank you for that, because I found out that a lot of people, they put labels, So I'm
Mm.
talking to a parent where we're still assessing, and we've not gotten to the end of the assessment yet. And the parents is saying, they've said it's his autism, they've said it's his ADHD.
Mm.
And I'm like, we've not done it. We're still in the process of assessment, because the assessment takes a period. I mean, it takes a long period. And then sometimes it's, people they already have a preconceived notion about what they think it is. So please don't label, don't diagnose. Having a difficulty is having a difficulty. Just say it as it is. We're not I'm trying to look for the right word to use now. Because of the world of modern technology, you can put in anything onto Google, and it will come up with Dr. Google will come up with a diagnosis. So please, really need to be careful. But I would
Yeah.
say that most times it's not a discussion you have at once. It might be, over time. Over time, and also depends on the relationship, getting to know the person better, and getting to know, having a relationship with the person such that the person can trust you, and that the person will know that, okay, this thing this discussion you're having with me is from a place of love, and it's from a place of wanting to help me, on like, I know, for example, sometimes, you're in a social setting, and a child who has got a disability and is, or maybe autism, or maybe they can't even sit still, and
Mm.
it's almost like as if they are making noise. And other people are like looking at the parents like, can't you do something, Can't you do something to that child? Can't you do something to make that child, keep quiet? So it's a really sensitive thing. So it's like, and I'll just say in summary, the right time, the right language, the right time, being sensitive, having a relationship with the person, helping the person to realize that, look, I'm coming from a place of love, and not labeling, not diagnosing, but just saying, okay, well, this is what I've seen, maybe we should seek help. Yeah.
Thank you. Can you hear me? Thank you. I'm going to round up, but I know somebody wants to ask you a question. Where are they?
Okay.
Uh, I saw your hand up not long ago. Please use your icon if you like to ask a question. Okay, somebody said, how do you tell your other family member about your children's diagnosis because you live far apart?
Right. So again, um,
Maybe you want to share with their
yeah,
cousins
so
or their.
again, being as truthful, as possible. One, two, there are resources, again, if you go online, that you can share and give it to them and tell them, go and read. But I would say, if we're going to use resources online, please, let's be sure, that they are reliable resources, because there's so many things, online. Um, and and again, it might also just be that having a family member who is educated about it, to talk to other family members, about the condition. And I've had cases where people have had to, they would ask us to, so how do I explain to grandma? Or how do I explain to grandma? Or how do I explain to grandpa? And sometimes I've had to, we do have some resources that we can give. So we call that psycho education. That's educating other family members or even the parents, about the condition and helping them to understand it such that it helps the relationship with both the parents and the child. Yeah.
Someone was trying to share their experience here. Would you like to share, Ma? Would you like to share your experience? Let me see. No, she said it's hard to accept when people first tell you about the suspected diagnosis. I fought with the first childminder that's that first told me there was a problem. She said she would like to share. Let me.
Okay.
Where are you, my? Where are you? I can't find you here to unmute you. Okay, I've seen you. Please unmute yourself.
Thank you.
Okay.
Thank you so much. This has been so good. I wish I knew you before, so many years ago when I started my journey. So my son is 17 now, and the very first childminder that told me that she feels there's a problem, honestly, I was so mad at her. I was like, how dare you say that to me about my son, And I literally, in fact, when I left her, I didn't leave her for that reason, but I was mad at her. And I didn't stay long with her anymore. But now, I'm like, God, I wish I had just taken her serious. I'm like, but the fact that she mentioned it, when I eventually got the diagnosis, it didn't really come as a shock to me. So I can actually say that her telling me kind of prepared me ahead of time. It kind of got me ready that, okay, maybe this woman was right. And my husband was so angry with the woman that those days. But now we don't really mind anymore. We're like, you know what? Let's educate people. There's nothing to hide anymore. The more you talk about it, the more people, new parents that are getting the diagnosis, they're not as afraid as we were then, because you can actually share your journey with them and help them to actually be more
to navigate
accepting
all
of the
those years.
diagnosis.
Yeah.
Yes. So my question is this: when they become teenagers, the
Yes.
hormonal,
Yeah.
how things just, because their body is literally, I mean, my son is proper 17-year-old boy. He's tall, he looks like a grown man now. But because his developmental age is still kind of, like a toddler. So it's confusing for him. He doesn't know what is happening. I don't know how the school, because he goes to a special school. He's actually in a residential school, so he only comes home during the holidays. But I mean, there was one time they told me in school that he had a hard-on and he was so confused. He was hitting himself and hitting himself and hitting himself. And it was so heartbreaking for me. I was like, my God, you guys are the specialists. You should be telling him how to, find a way of communicating it to him. So now my question is, how do I teach him that those things are normal? And I'm kind of confused because now I'm like, you know what?
Yeah.
He's going to be feeling like a proper man. He will
Yes.
feel girls and he will be attracted to them.
Yes. Yeah. First of all, I'd like to say thank you for sharing your story. I mean, it's encouraging, to know that you're also helping, other young families, because I think this is something that is very important and that is very needed. Support is needed. Research has shown that support helps parents and carers to navigate this journey better, and the outcome is better for the parents, the carers, and also for the young person or child or adults. So thank you for that. Now, but onto your question about your son. Usually, it's not unusual. So, like I tell people, when we have, a child with special needs will become a young person with special needs, will become an adult with special needs, because it doesn't go away. Except there's a miracle. And I'm a very firm believer of miracles. Okay, so I don't cross that out. However, how do we now navigate these phases? So for when they become teenagers, usually there's what we call social stories. So, it's almost like a form of a behavioral therapy. And so you have the social story will have so for example, this condition you're talking about, you'd have pictures, to explain what's happening. Though sometimes in situations like this, you have to be very careful such that it doesn't also put ideas, you see. Um, um, it doesn't put
Yes.
ideas, into his mind. Because I've had cases where I've had some of my patients, this is the kind of behavioral problem that brings them into clinic because they want to explore themselves, they want to explore what's happening to them, and they want to, and they've gotten access to a video or something, you see, and they kind of have an idea of what this thing can lead to,
In fact,
you know.
let me just quickly add this to it. So when in his former school, we had a group of mother moms, because he has always been in the special needs school.
Mm,
And the woman says she became a grandmother through her disabled son because the boy started exploring sex with another special needs girl. And before they knew it, the girl was pregnant. So as much as they don't understand what they're doing, when it comes to
mm,
that, I don't know, somehow they instinctively know what to do, and I'm like, hey, hello, wow, and it was overwhelming for me. I was like, my God, how do they, I mean, they don't even, they can't handle even bringing a child into the world.
mm.
So, I mean, ever since that woman told me that her son actually impregnated another girl, I almost ran mad. I was like, God, please, I don't think I have a heart to handle this kind of thing. So I'm very, very, I really want to educate him early enough so that we don't go down that kind of experience at all.
Yeah. So I would say speak with his school or his college and let them look at the route of using a social story. If they have a psychologist on their team, a psychologist, usually this is the kind of work that psychologists will do, you see. And sorry, if I may ask, your son, maybe we can talk about this. Maybe you get in touch with me,
Okay.
outside of this
Definitely,
platform.
definitely.
Yes.
We
Yes,
will.
get in touch with me outside of this platform and then we can explore things.
Okay.
We
Okay.
can
That would be
explore things further. Yes. But a social story format is one of the things that has come to my head. Um, I mean, very, 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 very quickly. But if you can contact me outside of this, then we can explore it further. And then
okay.
for girls, so for girls, just on the other side for girls, when it comes to having their periods, we found out that having their periods too, can be there's a lot of sensory factors to it. They can't explain or understand what's going on in their bodies, and it makes their behavior difficult to manage. So for some of the girls in that route, we go through, they have contraceptives. We do prescribe control. We work with the gynecologist and they will prescribe, or the GP, and prescribe contraceptives. And then for some who they might have to do what we call a capacity assessment to say that, okay, they don't have the mental capacity to consent to this. And so that means that their liberty might need to be restricted. And so then we need to go to the court of protection. That's from about the age of 16. So there's a lot of legalities also that comes
There
into
is,
this.
because I'm in the
Yes,
process
yeah.
of getting a deprivation of liberty for him
Yeah,
now,
so we also
and
use the yes, yeah,
that's another hectic thing that I'm going through right now,
yeah,
and it's a nightmare.
yeah. So we can explore it outside of this
Yes, yes,
this
definitely.
platform. Yeah.
I'll give you our contact details.
Okay,
Permission. With
thank you.
permission. Thank you so much, ma, for sharing.
Yeah, thank you. Yeah.
Really appreciate that. Take a lot of courage to share that. I'll quickly say there's a lady I know, and she'll say, I saw a picture of holiday, and I know they have a child who's got learning disability. I think the boy is autistic, sort of. So they went on holiday, and I was asking, where is that the boy? Where is he in the picture? Said, I didn't bring him to the holiday. Oh. And the boy, they live in Nigeria and they came to the UK. And I was like, why didn't you bring him? Say, You see the way we only traveled to Dubai last time, the way they were looking at us at the airport, he was making noise, he was doing this, and I said, do you know all his toys and all his, gadgets and everything that you can take him to trip with you, and said no. And she said in the word that the stigmatization is too much. So I started forwarding other video I saw on Instagram of other parents taking their children to everywhere in the world proudly, and people that you even sit with on the bus, and they see children that have learning disability, and they understand, and they're just smiling, and nobody is going to judge you. Nobody's, because they understand. So I started forwarding the videos to her. So she traveled to US and took the boy and sent video all the way from the airport. They were doing different videos till they get to the US and come back and say, thank you so much, that she saw a lot from those videos. I said that she never knew that she would be able to take the boy and all that. Thank you so much, Dr. Bimbo, for all you do. Please, everyone, if you need our help, that's what she does. She support parents with children, parents or children with special needs. Thank you so much for joining us, Ma. Thank you. Is there any other thing you like to add? Any other thing?
Yes, so I would like to say that, first of all, thank you, Dr. Tolutoro, for bringing me onto this platform. So based on based on, the burden that I just have to help parents, I want to start a support group. And I want to start the support group to help to address the emotional and mental health needs of parents who care for those with special needs. And I would like to say at this point too that it's because I'm a Christian, there's also going to be that spiritual part to it, because I have come to realize that human strength alone cannot carry, this load. I'm a parent myself, and I know what it is, to parent a child, not now to come and talk of when when you need to, almost as if some people would say, my life is on stop. My life just came to a stop when I had this child. But I want to say that you don't have to walk alone. And especially, I've also found out that we don't have that kind of support group as for parents of color, from African background. So so I want to do that. And I believe it's going to be a place where parents can talk to each other. It can be a safe place where you want to rant, you want to rave, you want to cry. Yes, you can do that. And then with the help of God, we'll see how we can, move things forward. And also it will be an opportunity for me to also help, use my experience, to see where I can give advice. So if you would like to, I would want you, Auntie Tolu, can I just share my
Yes, let me see.
So you can contact me on Instagram.
Yeah, I've already sent you. I can resend. Go on,
Okay.
You can share whatever you want to share if you have any.
Okay. Yeah.
So that group, would you have what's it called? WhatsApp group, WhatsApp group.
I think first of all, I just want people to, to get in touch with me.
Okay.
Get in touch with me. Tell me what you'd like us to talk about. And initially, it's going to be online. You see, for the ease of everybody, it's going to be online, and then we'll take it up from there.
Okay. Okay. Please use your phone and just take picture of that. Use your phone and take picture of that so that we can, you can go on Instagram and Facebook and just add that. Then send your direct message to her. You send your DM to her.
Yeah.
Then your journey start from there. And I want to know if parents of teenagers are struggling with emotions too can join. Because
yes,
do you understand?
Yes,
Teenagers are
yes, please.
struggling with emotions. If you have a child that you feel that they are not listening or something. No knowledge is too small. What do you think?
No. Yes, they can join in
Okay.
because sometimes it might just be that we need it might be a behavioral approach, and with the help of God,
Yeah.
yes, yeah, so you can join. Yeah.
Thank you.
Okay,
Thank you.
I'm going to stop sharing now.
Okay. Thank you so much. Please, everyone, unmute yourself and please help say a very big thank you.
You're very
to
welcome.
Dr.
Thank God.
Bimbo
Yeah.
for joining us tonight. Yes, we'll send
Thank you,
it.
Dr. Bimbo.
Thank you very much, Dr.
Oh, thank you so
Bimbo.
much,
Thank you
everybody.
so
Thank you for
much.
listening.
Dr.
Thank
God
you.
bless you.
Thank you, ma.